I'm a pediatrician, and I direct the pediatric pain and palliative care program at UCLA. And I've been doing pediatric pain clinical work and research for probably 30 years, a long time. And my primary interest is in complex chronic pain in children and complementary alternative medicine. My clinical practice, my outpatient work is mostly the child with complex chronic pain. So most of the children I see in my outpatient clinic have complex chronic pain. So they may have chronic daily headaches, complex regional pain syndrome, abdominal pain, muscle pain, a variety of fibromyalgia. In the inpatient work, it's more palliative care. Children, not just at the end of life, but children with a variety of diseases, including cancer, and helping with symptom management and communication, decision making, not just pain control, including that. My research, I'm interested in why some children develop chronic pain. And so I look at in my laboratory, which is an experimental pain psychophysiology laboratory, I look at children across puberty and look at the role of puberty, the role of child sex, and then the role of the parent-to-child pain relationship in the development of chronic pain. And more recently, we're looking at central pain inhibition and finding that mother's pain anxiety is a big driver of, at least in correlational studies, of decreased central pain inhibition for boys, but not for girls. And for girls, mother's pain anxiety relates to daughter's pain fear. And so we're now looking at the mechanism, how that happens, and then how to develop focused interventions. We've come a long way in pediatric pain, and we have yet a very long way to go. And I think the ultimate goal is looking at individual differences and targeting prevention strategies, education strategies before children develop chronic pain. Identifying vulnerable children, maybe in the school system, not just in the medical system. So identifying children and what are those factors, and then preventing chronic pain. And for children who do have chronic pain, individualizing therapies to prevent lifelong adult chronic pain. I think we need to continue to have clinicians do research. And I think so that you see the patients that you're doing research on, because that's where the ideas for the research come. And I think that it needs to be multidisciplinary. I've learned so much from the psychologists working with me. They've learned from me. We've learned from physiotherapists. I think clinicians should be involved in research so that the research is driven from the patients and the problems from the patients and solutions from the patients, and also that it needs to be interdisciplinary so that each discipline learns from each other. There are many tools that help children learn to have more of a sense of competence and control in managing their own pain, so that they don't catastrophize, that they feel like they know what they can do to help manage so that they can function. So that might be breathing, it might be using their imagination, it might be exercise, it could be many different things, deep breathing, slow breathing, so that when they are in pain, they feel like they can manage it. Obviously, if you're treating children, you're treating the family. And so it's important to look at both family factors that influence the pain or maybe keep the pain going and address those, and also help the family learn how to best help the child help himself or herself. And so giving strategies for the family for coping, for helping the child cope, as well as strategies for the child to help him or her cope so that they work jointly.